ambulation is a highly complex skill that requires not only a high level of postural control and walking ability, but also the ability to simultaneously engage in cognitive tasks while walking. An impaired ability to maintain balance while performing a cognitive task is a common occurrence in older adults. Poor dual task performance is associated with increased fall risk, so it's important that you incorporate gait-related dual task activities in your treatment plans to help patients achieve safe community ambulation and reintegration. The AlterG is a great tool to be able to perform these very important dual task activities so that patients can practice the skills needed to adapt to a constantly changing environment. The differential air pressure technology provides a fall-safe environment so that not only the patient feels comfortable, but you, the therapist, will too. Here are some dual task activities that you can start working on with your patients. For all these activities, have the patients put on the shorts backwards so that the zipper is in the back, and have the patient face the back of the machine. This will allow for a larger field of vision to work on these tasks. After calibration is complete, unweight the patient to 60 to 70% and press reverse on the control panel. Increase the walking speed to a comfortable pace between 2 to 3 miles per hour, depending on the patient's functional level. Visual scanning is key to safe community ambulation. Have the patient walk while performing head turns. Visually scan a pen light or flashlight on a wall in front of them. Perform head turns to read flashcards and return to midline between cards. Perform VOR exercises with an X placed 2 to 3 feet in front of them and ask them to maintain fixation on the X while turning their head left and right. Perform a naming activity. Select a letter in a category and have the patient name as many things from the category that begin with that specified letter. Make it more dynamic by adding a ball toss. Have the patient count backwards from 100 to 0 in 3s or 5s. You can also combine cognition with visual scanning by having them visually scan the room to name all objects of a certain color or shape. Remember to start these activities off slow and progress a patient when possible. Start off with half cervical rotations. Increase the body weight support or slow down the walking speed if a patient's postural control becomes impaired during these tasks. If the tasks become too easy for your patients, you can increase the walking speed or increase the demands by adding a cognitive component to the visual scanning activities. Email us at clinical@alterg.com if you have additional questions on dual task activities in the AlterG.